In terms of preparing for surgery, from the point of view of somebody who's facing a major operation and having had the perhaps unexpected and certainly worrying news that they've got lung cancer, what's the best approach people can take to getting ready for surgery?
So it's a very good question, because it's not only about the surgeon performing the operation which leads to successful outcome, but it's also preparation of the patient for the surgery. So I think two most important things which majority of the patients can do is stop smoking if they still continue smoking, because they prepare them for the surgery with low risk when they undergo surgery. Secondly is to condition themselves a little bit. So what I usually recommend in my practice is for every patient who is scheduled for surgery to perform about 30 minutes of brisk walking every day. I usually recommend to walk 10 minutes slowly to sort of warm up, and 10 minutes to walk briskly when they are basically training their body and their lungs for possible stress in the future. And then 10 minutes walk slowly again to slow down and to sort of cool down. And if they do it every day, once or twice, they should give them they should prepare the body for certain stress which will be there after the surgery as such, which will help with postoperative physiotherapy and decreasing of possible risks of the operations as such. Obviously, as regards, for example, diet, so we usually don't recommend any sort of strict dieting before the surgery. Even in patients who are obese, there's no recommendation to actually drastically reduce their weight. Partly it's because we are aiming to operate on a patient with lung cancer as soon as we can, to decrease their pathway and to decrease risk that the findings after surgery will be more advanced than expected from the imaging. And partly because we know that if patients lose a lot of weight before surgery, they're actually increasing their risks after operation. So if somebody wants to lose weight, it's not recommended to lose more than about 1 kilogram or 2 pounds per 1 week. So if they aim to optimize their well-being, it's better to probably leave it after recovery from the surgery, when they can continue without any risks.
Another thing, while sometimes a lung cancer diagnosis can happen quite suddenly and unexpectedly, there can be a number of stages in terms of someone going to their GP with concerns, perhaps having some tests and then being referred on to the hospital. So once someone finds out it's planned to have lung surgery, roughly how long on average is it between that decision to have surgery and the time when they'll have their surgery?
So there is some evidence showing that the shorter the pathway it is, the less likely there will be unexpected advance of the cancer after operation. So we are aiming to operate as soon as we can. So in general, since the patient is referred from GP to surgery, there are recommendations to operate within 62 days. That's what the current guidelines are aiming for in the whole UK. But obviously there are centers which are aiming to operate much earlier than that, for already mentioned reasons. I would think that in general, the operation usually happens between 2 and 4 weeks, which will be probably ideal. In some cases, it might be longer, especially in patients who have a small lesion which needs CT follow-ups in the future. Then obviously, we are not aiming to operate immediately, but actually when we know that the lesion is growing and it's more likely to be cancer. On the other hand, in some circumstances, we are aiming to operate as soon as we can, especially in more advanced cases when if there is any delay, it might lead to less optimal outcomes.